Okay, hi everyone. Good evening. Welcome. Hope all of you are able to see my screen and hope all of you can hear me. Can I have a quick confirmation, please? Wonderful. Thank you. All right. So where we are, if I'm not wrong, we are talking about the interventions, right? So under the interventions, we have begun our session with how to deal with non-study drug or non-study treatment. That is, any medicine or any treatment other than the study drug or study treatment, what is the impact, how the data will be stored. For that, we have a domain, we can call it as a concomitant medication. Correct? So concomitant medication, you are going to take this particular one because of the adverse event, or it can be because of the clinical event, or it can be because of the medical history. If you are targeting about a study treatment or a study drug, then you have two different domains for that. One is exposure, the other one is exposure as collected. Among these two, your exposure domain is primarily for your exposure domain, which is nothing but EX, is primarily for unblinded treatment. Anything unblinded, the data will go here. Here, it is purely based on what is defined in your protocol. As per the protocol definitions, we are going to load this particular data. When it comes to the exposure as selected, it is as per protocol specified medication administered as collected. That too per mode. What do you mean by per mode? Per mode is going to be having two different values. One is going to be scheduled, another one is going to be already what is that? Completed. You can also call it as a completed. Correct? Scheduled or already done. Right. So here we are going to have the details about, let's say, along with the specified dosage or along with the specified medication, whether the medication has taken or not, if anything. If the patient haven't taken the medication, in that particular case, you have something called MH occur. That MH occur is going to talk about on which day the patient has not taken the medication. So this one is your EX is a derived domain from the EC. If you unmask your EC, you are going to get your yes. Correct? Simplest way of telling this is going to be your EC is going to be more general. That is that your EC treatment is more generic. I can simply say that the patient has to take either placebo or treatment. But only when it comes to your EXTRT, you clearly understand whether the patient has provided with a placebo or the patient has been provided with the original treatment. What exactly has been provided, that details will be only given under your EX treatment, but not under EC treatment. Suppose if I am going with a 200 mg of the tablet, the EC treatment simply going to take 200 mg. When it comes to the EX treatment, for placebo, it is going to be 0, whereas only for the group, that is interventions and control group, only for the interventions group where the treatment originally given, only for that particular group, your dosage, your units, your frequency, everything will be mentioned. So your EX treatment is the more precise one, whereas your EC treatment is the blinded one. Under the EC treatment, there is something called your EH occur. This is going to be defined whether the subject has taken that particular medicine or not. If it is yes, it's going all good. If it is N, the patient or the subject hasn't taken that particular medicine because of any reason. Correct? These are the various things that we have discussed under your intervention so far. Correct? So there is one more domain that we need to discuss here, and that domain is nothing but your substance usage. So that is the one that we are going to discuss today. So before I start with this, anyone have any questions? Kindly tell me so that I can answer them and then I can proceed with the today's domain. Anyone, any questions? All right. So I haven't get any response. So I'll be in assumption that all of you are comfortable with it. So with that assumption, I'm just proceeding with your today's class today, which is nothing but substance use. Okay, I can start writing the notes for it. So for this, what I can do is I can take our latest notes, which is on EC. I just modify this particular one. Okay, because most of the variables again are going to be repeated here. That's the reason I'm doing this. So instead of this, it is going to be substance usage. Here it is going to be SU. Okay, so all these details are not required. So straight away we can go ahead with substance use, which is nothing but SU. So now what it will capture? So it is going to capture the details of subjects habits. I can simply say that it is going to capture substance use information or subjects habits. Simply I can say it is going to capture subject habits. Why we need this? Why are you going to use it? This way will be, maybe technically speaking, we can call this as a subjects substance usage. Substance use information. The substance use information is nothing but the habits. Okay, that may be assess, maybe used to assess safety and efficacy of which one? Which one? Our study drug, our study treatment, or you can simply say that maybe use it to assess your study drug or treatment safety and efficacy. Simply, or in other words, if you want to talk normally, it captures subjects habits. Simple, it is going to do subject habits, as simple as that. Simply it is going to talk about the habit. Okay, sorry, I think not double, right? So if you, even if you want to further go with what kind of habits, it is going to be like habits like smoking. It can be of taking consumption of alcohol. Am I correct or not? It can be anything. It can be of your alcohol usage, or it can be of your alcohol, or it can be even the habits related to coffee. Right? It can be anything. Subjects habits it is going to capture, because it is going to have an impact on the medication that you are using. Yes, tobacco usage. You can also take the smoking will come under the tobacco usage. Correct? That can be smoking, that can be alcohol, that can be coffee, or anything. Okay, so what is going to be the nature? One record per, after the second remove, one record per recorded substance, one record per substance type per reported occurrence. I can say that one record per substance type, because if it is a smoking, for smoking it is going to, there is going to be a type. If it is a alcohol consumption, there is going to be another type. Like this for each substance type per reported occurrence. What do you mean by per reported occurrence? Maybe I can explain this so that you can easily understand this. Per subject, let's say the subject is having, he's a smoker. So smoking means it is going to be a tobacco usage, right? Directly. Okay. So your substance type is tobacco. But we also said that per reported occurrence. So the meaning of per reported occurrence here is going with the tobacco, that too, let's say The group is going to be, the category is going to be tobacco. The subcategory is going to be like cigars. Again, when it comes to the cigar, how many packets? One pack. The frequency is going to be per day. So how we are mentioning here, you can see he's taking cigars, one pack per day, right? So one pack here, and it is going to be every day. So we are going to have the details as QE. Is that making sense what I'm trying to say? So that's the reason we have to say that it is not just your reported, it's not just about your substance type, it is also about your reported occurrence. The occurrence also will be mentioned. Right? More details about this we are going to see. What is going to be the topic variable? By this time, you all might know that the topic variable is going to be SUTRT. The SUTRT here is all about the reported name of the substance. It is not going to be considered as a treatment. It is going to be a reported name of the substance. We'll talk about this. So let's start with the identifier variables. Study ID, domain, unique subject ID, all these same. The sequence number will be there. You're going to have the group ID. You're going to have the, you don't have the reference IDs here. The reference ID will not be your identifier variable, so it will be eliminated. You're going to have your sponsor defined identifier, so it is going to be there. After that, there is no link IDs, there is no link groups. So you're going to have only 6 identifier variables. 3 of them are well known to us: study ID, your domain, and your unique subject ID. One is the sequence number, which is going to be unique at the subject level. So group of related records, you are going to tie it with some group ID, that is nothing but your substance group ID. Any of your sponsor defined identifiers, which will be part of your sponsors database or which is part of your CRF, will be considered as your SP, that is sponsor defined identifier. So that is SUSPID. So these are the various identifier variables. So let's start with your variable identification, variable definitions and labels. The first one, study ID, study identifier, domain abbreviation, 2-character long domain abbreviation. In our case, it is going to be substance using SU. And again, there is no change in your unique subject ID. It is going to be a unique subject identifier, which is going to be a concatenation of 3 variables: study ID, site ID, and subject ID. Then when it comes to the SU sequence, it is going to be the sequence number, any numeric, but it should be unique at the subject level within the domain. So simply I can say that here I am going to write it as a SU sequence. How you are going to generate it? By using generally by using first start and last start. So group ID, related records, you are going to group together, and we call that as a group ID. And sponsor defined identifier, the same thing. It is going to be like here, either it is printed on your CRF or it will be part of your, it is part of your, what is that? What is that? Your sponsor defined database. Okay, here it is not a line number. Line numbers in the treatment pages. It is not about the treatment pages, right? Then what is going to be? It is, let's say that maybe the line numbers, whatever the line numbers that we are talking about, line number on tobacco and alcohol defined pages or alcohol use on CRF. So you're going to have in somewhere in your CRF, they will mention about what is the tobacco and alcohol usage of this particular subject or these details. These will be present in your case report form itself. So those details will be part of this one. Correct? So now it's the time we can go ahead with there is no reference ID here, there is no link ID here, there is no link group here. I can simply remove these 3. Now I can go with the treatment, that is SU treatment. It is not name of the treatment, it is instead of, it is name of the substance. What is the substance that the patient is using? Remember, when you talk about the name of the substance, it is simply the substance name. The examples are going to be, what are the examples? We have already given few. Maybe I can go with some good ones. Coffee, tea, then I can go with alcohol, not a good one, just I'm telling you now, from now onwards, it is going to be like cigarettes, correct? These are all the various ones that we are going to mention there, correct? These are not the categories, these are direct substances, correct? Having consumption of tea, alcohol, and coffee, smoking a cigarette, or having a beer, or it can be drinking wine. So the direct name I'm going to give it as a treatment, correct? Then we are going to have, for the coding purpose, what we can do is we can slightly modify this particular one for coding purpose. Generally, you are going to use AE modify, MH modify, and all, right? So similarly, you are going to use here, which is nothing but SU modify. SU modify is nothing but modified substance name. It is not all about modified substance name. So why do you do this particular one? Why do you do this particular one? Only for the coding purpose. Simply we are going to use it for the coding purpose, correct? So there is going to be a similar term on this particular one, and that similar term is going to be SU decode. What do you mean by decode? A dictionary defined one, correct? Or it is going to be a standard substance name. So there are two things. One, it can be a dictionary defined, or it can be a standard substance name. I'll tell you why I'm writing both of them here. Dictionary defined substance name. Why two names are coming to the picture? The reason is going to be SUD code is nothing but this particular one. The dictionary here we are talking is WHO, World Health Organization. If anything is defined there, you can use that particular meaning. If it is not defined, the substance is not defined there, then you are going to use the standard substance name. Any one of it you can use it. That's the reason we have given both the, yeah. All right. So now we will go with your SU category. That is not a treatment category here. Instead, it is going to be a substance category. Okay, what do you mean by substance category? All the related records you are going to mention here. Now we go on a high level. I can say that here the examples are going to be. Here it is not like cigarette. Instead of cigarette, you can go with tobacco, because your cigarettes or anything that is made of your tobacco will come here, right? Yes, Raja, you are right. Then instead of saying coffee or a mocha, or it is going to be latte, or it is going to be espresso, instead of telling all this, simply we are going to say it is going to be caffeine. That's CAFFEI, caffeine, correct? So instead of telling beer, wine, all this kind of a stuff, simply we can say alcohol. Yes, nicotine. Yes, we can also use that. Sure, we can also use that. Right? So these are going to be categories. Now the subcategory is going to be subcategory of the substance. So here I can say that I'll go with the previous examples now. So what are the examples I can touch base here under this particular one? I'll go with cigars. I'll go with cigarettes. Both of them are different, right? And then we can also use these two. When it comes to the alcohol, we use these two. Correct? And when it comes to coffee, we can go with latte, or we can go with mocha, or we can go with espresso, or we can go with frappuccino, right? All these can be used under the subcategories. Correct? So this is about your subcategory. What is the next thing? There is no Those is still there. Those are still there. So I'll just go in a order. Maybe some pre-specified. Okay, no problem. I'll write it. So that next thing is going to be SUPREST pre-specified. So who is going to specify this particular one? I can say that SU pre-specified, substance pre-specified. So where it will be pre-specified? So why do you need to record this particular one? What do you mean by pre-specified one? Right? So I can say that it can be indicate on your CRF in CRF, right? A specific substance usage is allowed or permitted, then we can have this particular, or I can say like this. Specific substance usage is allowed or permitted, then we can have these details in CRF. We can have these details in CRF. So we are going to use the controlled terminology here, whether it is pre-specified or not. So we'll say that simply terminologies, yes or no. So what do you mean by that? Few things are allowed, right? Let's say a patient, he cannot be without having a coffee in a day. At least once in a day, the subject has to take the coffee. So it is pre-specified during this itself, that is during the screening itself, it is pre-specified. So sponsor also okay with that particular one because it is not affecting any of your, it is not affecting any of your, what is that? Can I say efficacy or safety of your study drug or study treatment? So even your who is that? Your sponsor also, or even the sponsor is okay with that particular one. So because of that particular reason, we can simply say that this is allowed, this is permitted. You understand, right? What I'm trying to say? If it is not having any effect or impact on your a direct study treatment or study drug, in that particular case, it will be pre-specified. So if it is pre-specified, then we can going to use yes. If it is not pre-specified, it is going to be sorry, it is going to be null. Only if it is pre-specified, it will be there. If it is not pre-specified, you don't find any value for that particular one. Make sense? Okay. Now the related value for this particular one is going to be, that is the related variable for this particular one is going to be SU occur. So what do you mean by SU occur? I can say that substance occurrence. So this will come to the picture only for the records where your SU pre-specified is mentioned, right? That is specific substance usage is allowed or permitted. That is indirectly if SUPRESP, if SUPRSP is there, then permitted, then SU occurrence used to indicate with yes or no. What do you mean by that? If that particular substance is allowed, then it is going to be Y as your pre-specified one. If it is Y, then I'm going to have yes, yeah. That is your SU occurrence is going to be yes. If it have value is null here, for the coding purpose, you require the control terminology, and the control terminology here is going to be yeah. Make sense? How we are defining this particular one? If it is direct, it is directly related to your SU occurrence. It is directly related to your SU occurrence. Is this clear, guys? This particular one, can I have a quick confirmation? Every one of you? Right? All right. Now, the next thing that I would like to talk here is going to be I would like to go with SU stat. What do you mean by stat? Status. That is substance status or the completion status. So we are going to have a terminology for that. What is going to be the terminology? What do you mean by that? So again, this is also straight away related to your previous one. A specific substance usage is allotted or permitted if it happens, right? Right? Can someone tell me that when the usage of this particular one is allocated or when the usage of this a particular substance is allowed, right? Then what you are going to do? Then you are going to use this particular one. Then SU status used to indicate. Then SU substance is used to indicate whether there is a response to all the questions or not. Or then SU stat used to indicate whether all the questions related to this, all the questions related to this are answered or not. Correct or not? Everywhere the status we are going to use it for the same thing, right? What are going to be the control terminologies for this? Yes or no. Again, the same stuff comes to the picture. Again, if it is no, if it is not completed, means all the questions are not answered. Then what you are going to do? If the questions are not answered immediately, then you are going to use another variable, which is nothing but the reason for not done. SCREASND. That is, see that your substance usage reason for not done. Reason substance use not collected. So we need to specify this, specifically need to give the reason for that particular one. Correct? So generally, what is going to be the reasons? What are going to be the reasons for that? Can I say that the examples are going to be, one is forgot to ask. The other one is subject left before CRF is completed. Am I correct? Both of them are possible, right? Subject left before CRF preparation is completed. Before that, the subject itself is left. Or subject left office before CRF. All these things you can see it in their examples. Correct? That is nothing but why that particular one is not done. Right? So again, the substances can be comes under different use classes. So those use classes and the use class codes can be defined by using substance use class. And for each use class, there is going to be a code. That code can be mentioned under substance use class code. These are going to be the standard ones. So under which use class the particular substance comes to the picture. If this is the use class, then what is going to be the respective code for that? Those information will be under your substance class and substance class code. Now, as usual, we'll go with the substance dosage, right? So this is nothing but what is nothing but your what is your substance use? It is not the administration, it is not dose per administration. Instead, how much the subject is consumed, correct? So this is nothing but substance use consumption. How much is consumed? It is subject use consumption. All right. Or it is also can be mentioned as amount of SUTRT. What is your SUTRT? Reported name of your substance. How much amount the subject has taken this particular one. That information will be mentioned here. Then you are going to have this one, that is substance use consumption description. A detailed one. It is a detailed one. Then you are going to have SU dose, which is nothing but how much is going to be the consumption units, not how much, what are the consumption units. Again, the consumption units, when it comes to the picture, what are the units that you are going to get it here? Milligrams. For legal ones, you don't get it, correct? Only for the weed and all, you are going to get it. So what you're going to get it there? Ounces, correct? Maybe grams, packets, how many cigarette packets and all, right? Like this. Am I correct or not? It can be of your ounces, or it can be of the grams, or it can be of the packets. Quantity. In a while, we can say that it is going to be a quantity. Correct? Again, it is going to be SU, which is nothing but your treatment form or your dose form, whatever you can mention. Again, the examples are going to be the same. Either it can be a liquid, or it is going to be a powder format, or it can be of your maybe injectables, correct? So though some of them are legal as well, so that's the reason I'm just writing this here, correct? Injectables. So all this comes under your dosage form, correct? Is the dosage frequency will come here? Will it come or not? Yes, it will come, right? Instead of dose frequency, you can call it as a use frequency per interval. Instead of dose frequency, we'll call it as a use frequency per interval. It will come here, correct? What is the next thing? Anyone? I'm just checking. Okay, how many of them will be used? Okay, so before we go with this one, in the concomitant medication and in the exposure, we have one more field which will be called it as DOS total, which is nothing but what is the total dosage. Am I correct? So that one will come here, because what is going to be the total daily consumption. So for that particular one, we can go with SU DOS TOT, which is nothing but total daily consumption. How many cigarettes? Let's say 2 packs, right? Or it can be 3 packs. Or if you're talking them in terms of the units, 20 units a day, 10 units a day, right? So that will be comes under total daily consumption. That is a total daily consumption. What is that? Dosage regimen part, we don't get it here, because there is no on and off, because it's not a treatment, or it is not either it is not a study treatment or non-study treatment. Only for the treatments you are going to have a washout period there. For here you don't get it. So here I'm going to have SU route. So the SU route is nothing but the same route of administration. It can be oral or it can be intravenous. The same thing will come to the picture. There is no lot, because it is not coming in a lots and all, so you don't get the location of your dose administration. Laterality you don't define, directionality you don't define, fasting status will not be applicable here, the pharmaceutical strength will not be applicable here, pharmaceutical group units will not be applicable here. It is not something that we want to do. It's a food habit or the habit of the subject, so drug adjustment will not come to the picture. Approach, because we are not giving it, correct? Anything which you are specifying in your protocol, then approach comes to the picture, so even approach will not come. So guys, you understand what I'm trying to say? What and all will be relevant, I'm just keeping here. Which is not relevant straight away, I'm deleting them, right? So now we can start with start, that is start date and time of substance use. All right, the same thing I can go ahead with end date and time of substance use. Then we can calculate study day of start of substance use. Then study day of end of substance use. Correct? So these we can keep it here, right? All these not going to change. As usual, we are going to use them. Done. Up to this, all of you are clear. 4 dates, because these are common in every domain, so we can use them as these. So the next thing is going to be SU duration. So what do you mean by that? Duration of substance use, right? It is not a derived one. You're going to capture it from your CRF. Just give me a second. All right. So then, just give me a second. Which one? Up to this, I'll use it. Let me open exposure domain, because some of the variables I can copy from here. That's the reason I'm taking this. So here you can see something called your STRF. Just a second. Okay, because these are important and we should define them. Just trying to figure out. This one I can use. So can you see that here I have start related to the reference point, right? Whether it is going to be a prior one, that is prior to the treatment it is started, or it is an ongoing one, or it is a continuing one. So we have these details, right? So that is nothing but your start related to the reference time period. That one I can take it and I can use it here as SU. The same, the meaning is going to be the same. Start relative to the reference point, that is substance use, that is it is going to describe the start of the substance use relative to the sponsor defined reference period, right? It can be of year prior to the defined period, or it is going to be ongoing, right? So in the examples you can see that when you are doing the project you can understand this particular. That is, let's say smoking. The patient have this particular smoking habit before he come to the treatment itself. So that is before he come to your collection itself, or before he come to the clinical trials itself. And during the clinical trials also he is continuing, that he haven't stopped it. He haven't stopped it. So what is going to happen? That is, there is no end date. This one, there is no SUENDTC. The substance usage end date is not there. So when it is started, before, prior to the treatment itself, it is started, and there is no end. So in this case, can I say that it is going to be prior? Am I correct or not? Correct. Prior to the substance usage itself, the subject is having this particular habit. So this reference time, the reference point is going to give you the information about from when the substance usage is started, or from when the substance usage is already completed. Let's say the subject had the smoking habit, but before he come to the clinical trials, he stopped smoking. So we have SUENDTC. In that particular case, it is already completed. So that information you are going to have it here. So similar to this particular one, I also have end related to the reference point, right? So this is going to be end relative. Again, this is going to be the one. These two are the regular ones. If I go with the time references for that, that is start related to the reference time point, end related to the reference time point, then I'm going to have SUSTR TPT, S2ENR TPT. Those two are also here. take it as is. So what is this? The SU is nothing but end. Oh, this is start. Start relative to the reference time point. End relative to the reference time. Correct? So these two will be depends on two more things, which is nothing but what are those time points are. Correct? Those time points we are going to take now. SUSTPT, which is nothing but start reference time point. Then I have ENTPT. This is nothing but end reference time point. Is it understandable, guys? So we just simply copy this particular one from your concomitant medication because we have already discussed that. There won't be any changes. So I'm straight away using this. Questions? Easy. Any questions here? Can I have a quick confirmation? All of you are able to follow this? All right. So one thing I want to tell you guys, I mess up with your project because the one that I have shared you, that's a different control terminology, or that is going to be a different specification Excel that I have shared in this particular project. So I'll rework on this and I'll share the details with you. Don't worry, tomorrow I'll share. So I may work on this by tomorrow 11 o'clock or 12 o'clock in the morning. I'll share it across with you. If you don't get it, let me know. Okay, if you don't get it, let me know. Just ping me once so that I can answer that. Right? I need to reshare all your data. That's what I'm. Okay. There is no difference between ongoing and continuing. It must be ongoing or continuing. Where it is? Substance usage. I must put R. Even in your, even if you go to your, what is this? Implementation guide, you can also see the same. It can be ongoing or it can be continuing. It is R. Okay. All right. So let me rework on this and I can share it with you by tomorrow. So what we can do is the next class is on Monday. Monday class is on demographics end-to-end. Okay. Then I'm going to share you the right details with you so that you can work on whatever the related domains are part of your project. You can work on it. I can also give you the mapping, which domain, what is going to be the task. That also I will provide you by tomorrow. So please remind me once by tomorrow so that I can share it. 90% I can share it before 12 o'clock in the morning. If not, remind me. Okay. In another 1.5 weeks, we can complete your SDTM. 1.5 weeks to 2 weeks. Then we can go with ADaM and TLS. TLS is very fast. Whoever is good with proc report, it will be easy. It is mostly reporting because it's all about tables, listings, because you don't find much difficulty there. So only difficulty part after this is going to be ADaM. So ADaM, if you have a proper base for your SDTM, then we can easily understand ADaM as well. Not a big deal. Okay. Questions, ask me. If not, we can wind up the sessions. You said you will share and discuss the examples or EX versus CC. I forgot that. So we will discuss it on Monday. So first I'll go with the demographics coding. Once I complete it, I'll explain. Don't worry. Priyanka, remind me and once I complete the design coding. Please remind me. Yeah, thank you.